Sheriff Nowels, first of all, I appreciate the job that you do. You and your staff, you represent our community in a great way. And so thank you for the service that you provide.
Well, thank you for saying that. And it's an absolute honor to represent this community and to be the sheriff of a community that I've grown up in.
One of the things I was going to ask you to share, if you wouldn't mind sharing, is we know today that fentanyl's become a major issue in our surrounding area. What's the problem looking like?
We are in a tougher spot as a community than we've ever been, where the drug use, the drug trade is concerned. And back in the early 2000s, we saw a lot of meth labs and a lot of methamphetamine in our community. But as time marched on, the drug trade in Spokane has evolved and changed. Mm-hmm. With this opioid epidemic, there are challenges that methamphetamine didn't present. It affects people physically, is highly, highly addictive. Mm-hmm. People become physically dependent on it. When you go into severe physical withdrawals, when you don't have that drug that your body demands you to have. I mean, this isn't a oh, I'd sure like to have it, like you might want lemonade on a nice hot summer day. Yeah. This is I have to have this, and I will do whatever I have to do to get my next dose of this drug. And they will do anything they believe they will die without it. And so that's how fentanyl has kind of changed the game, and it's lethal.
So you have also to combine the cost way down and the availability. Once you take it, I understand you're addicted, you can become addicted instantly. What about statistics on the number that are dying?
Well, I think it was in 2018 we had 45 overdose deaths in Spokane County. And I may be off a little bit on those numbers, but it was well under 100. Yeah. To where in 2024 we had so far confirmed over 330 overdose deaths. And I want to provide some context with that number. There's been hundreds and hundreds and hundreds of Narcan doses delivered every year that save people who have overdosed and are dead. Yeah. And Narcan is saving them. Yeah. And so that 330 number could be much higher if it wasn't for the advent of Narcan and naloxone.
A lot of times we kind of put fentanyl, the impact on homelessness or crime in our city, but it affects families as well. And I've heard your story, and I thought it'd be good just for your own personal journey that you went through with your daughter to share a little bit about that and how it impacted you. You mind sharing that story with us, John?
Yeah, I don't mind at all, and I speak about my experience with my daughter Sarah, with her permission, and she has openly shared her story. You know, she's a really, really fantastic young woman. Played travel softball, played for one of the top teams in the area, one of the top teams in the state, one of the top teams in the country. When she turned 17, she decided to quit playing sports and started running START program in college and started a job. We thought everything was going really, really well. And then one day we found out that she was, kind of behind mom and dad's back, seeing a young man who was about 24 years old. Eventually it became apparent to us that she wasn't going to follow the rules of our household. She was introduced to fentanyl by that boyfriend. At one point her boyfriend overdosed in our home. That was the last time I had to have the conversation with my daughter, saying, you have to choose. Yeah. You have to choose him and the drugs or us. Yeah. And you're more than welcome to stay with us, but he is not. And she chose him. Yeah. And so, you fast forward that for a couple of years, and she saw a lot of different things while she was addicted. A lot of very, very traumatic things happened while she was on the street and bouncing between, the couch surfing that goes on when you decide to live that lifestyle. My daughter's personality entirely changed. Loved her to death, but she was so mean when she was using. And it was two and a half years ago now when she came to a family function at Christmas, and I didn't even recognize my daughter. I just remember thinking, your daughter's going to die, and will you be able to say you did everything that you could do to prevent it when you're in that moment when you're burying her? did you do everything you could? And I knew that I hadn't at that point. So very next morning, I went out looking for her on my way into the office, and I went and found her. She was sleeping on the floor of a shop down in the city. I had the help of some really good friends who worked in the mental health care field, and we got her committed because she had made some statements that led us to believe she was suicidal, and she knew she was going to hurt. She was in a lot of pain, and I remember when I was telling her that the police were coming, and she said, "Dad, I don't want to go because it's going to hurt." And I remember very distinctly telling her, I go, "Well, honey, I'm sorry, I can't take that from you." You know, as a father, you know, as somebody who cares about another person, we so much want to take their pain if we can. But there are some things in this world that we can't, but it changed her. And she is such a different person. My wife and I are different people after seeing her go through this, and then, you know, having to support her coming out the other side and watch the physical change back. And have it be a success story that she did get to blossom into this great woman who is now helping people, who understands human nature in a way that a lot of people don't. Work with other people who are in recovery to help those who are still lost. And we do need more supports in the community for people who are in addiction, people who are recovering. Every time I get a chance to talk to people, and number one, destigmatize talking about addiction, and destigmatize the idea that we should somehow think differently about somebody who's in recovery. I mean, somebody who's in recovery, to me, they're my heroes. If people have any kind of sympathy or empathy about what it would take to overcome addiction and go through not only the physical but the emotional challenges that come with kicking that addiction, it's nothing short of heroic. And we should be doing everything we can to help support people who are making those choices. And that's what I love so much about what the Union Gospel Mission is doing. We're meeting people where they're at. We're asking them to expect more of themselves. And that's what changes people. It's about each individual person getting what they need to make the choice. I mean, I think you know, you and I both recognize, you know, I didn't get my daughter into recovery. My daughter decided to change.
Exactly.
You know, I tried to get her to a point where she was able to make that decision, and I think that's important. And that's what we can do as a community. But we have to make every effort we can to help people make the choice to get clean.
I realize that it's God's the one that changes a heart and draws a person back to who He created them to be. And I hope people have hope for their children that are maybe out there, and hope for those that are out on the street, because we see change every day. So thank you for taking the time and joining us.
It's my pleasure, anytime.